Lauren was in the second patrol vehicle when the blast hit.
A large military vehicle travels down a road at night. An explosion rocks the vehicle. Lauren leans over the steering wheel.
The force of the explosion injured her back. Later, she began to have vivid nightmares about the incident.
Her arms jerk while she sleeps in a bed. She suddenly wakes up.
Trying to cope and rest, she began to misuse opioids.
She sits up and places her hand on her lower back.
But her sleep just got worse.
A man stands in front of a brick wall in the shadow of flashing lights on an ambulance.
Eddie has been having a hard time since seeing his brother suffer a fatal heart attack. He lost interest in things that used to bring him joy, like listening to music.
Eddie removes headphones from his ears.
And getting outside with friends.
His friends jog in the park, but Eddie is not with them.
In the quiet moments by himself, haunted by feelings of guilt that he couldn't save his brother, he started to drink more and more.
Eddie sits at a bar looking upset. Bottles of alcoholic beverages appear next to him one by one.
It didn't make anything better. The few times he tried to go out, he had a panic attack.
He opens the front door and stands in the doorframe. The door and the exterior walls of the house begin to distort into waves. He slams the door shut.
Lauren and Eddie are not alone. Traumatic events may cause physical injuries and emotional distress, which can have a ripple effect on a person's life.
We see flashbacks of Lauren holding her lower back in pain and Eddie having a panic attack.
They can also lead a person to use substances in an attempt to reduce the after effects.
A group of people looking sad.
In fact, many people with post-traumatic stress disorder also experience a substance use disorder, just like Lauren and Eddie. Post-traumatic stress disorder, or PTSD, can lead to sleep problems, feelings of anxiety, irritation, or guilt, and withdrawing from family and friends. Substance use disorder, or SUD, causes people to have difficulty controlling their use of alcohol or drugs. This can lead to medical problems and conflict at work or home. It can also place people in risky situations. Together, PTSD and SUD can make each condition worse.
A bubble that contains the word PTSD and a bubble that contains the word SUD move closer together and combine into one big bubble.
Using alcohol or drugs can increase PTSD symptoms. For example, your sleep quality may decline.
Lauren tosses and turns in her sleep.
And you may have more intense feelings of numbness or isolation.
Eddie closes the door and looks through a small window next to the door, isolating himself from the outside world.
It's important to know help and hope are available. There are effective treatments for PTSD and SUD, and evidence shows that treating them at the same time works. For PTSD, trauma-focused psychotherapies are the most effective treatment. These include cognitive processing therapy, prolonged exposure, and eye movement desensitization and reprocessing, or EMDR. For SUD, the most effective treatments include relapse prevention and cognitive behavioral therapy. There are also medications that have been shown to work well. You can be in treatment for PTSD and SUD at the same time. Another option is to treat both together. An option with strong results is called COPE.
A bubble that contains PTSD and a bubble that contains SUD move closer together and combine into one big bubble. The new bubble reveals the word COPE,
or concurrent treatment of PTSD and substance use disorders using prolonged exposure. Whichever path you choose, treatment can help you better understand how PTSD and SUD interact, address the impact of your trauma, and decrease your use of substances. You can start by talking with a healthcare professional.
Eddie approaches a woman behind a desk that contains a sign that reads, "Appointment check-in."
They can help find the most effective treatment plan for you to address both PTSD and SUD.
Lauren sits on the edge of her bed and stretches both arms into the air after a restful night's sleep. The morning sun streams through the window.
Remember, feeling better is possible. you can effectively manage your trauma symptoms and substance use to start feeling more like yourself and get back to doing the things you love.
Eddie joins his two friends at the park. A butterfly flutters by as the sun's rays shine on Eddie.
Learn more at ptsd.va.gov.
A QR code appears.
This video was brought to you by the Department of Veterans Affairs National Center for PTSD.
The logo for the National Center for PTSD appears, and then the logo for the Department of Veterans Affairs appears.